Hi, this is Nancy Reedy, and I'm going to do a diabetic foot exam on a 54-year-old female with type 2 diabetes times 10 years, and I have obtained and gained consent for recording of this examination. All right, I'm going to do a digital and musculoskeletal examination to start out with. I'm looking for any bone deformities, for hammer toes, claw toes, any plantar metatarsal head prominence, bunions, and if any of those are protruding, those are pressure points. I'm going to just use one foot. I may go back and forth between feet if maybe I think you could see it better on the other foot. But whatever I do on one foot, I'm going to do on the other foot during my examination. But anyway, any calluses, any type of hammer claw toes is areas of pressure that could lead to ulcers and infection. Charcot's arthropathy is where the middle bones fall and your foot's flat in here. You could develop pressure there, infection. Some people mistake it for an infection, and you have to get that treated by a doctor. And her foot has a nice arch in it. I'm going to test for equinus, which is a tight heel Achilles tendon there. Should be able to bend back 90 degrees. If you have these prominent areas here, you could get ulcers there, and she does not have them. And this Charcot's, a lot of times that might not be painful, so that's why you want to be sure and do a good foot examination. Amputations could cause pressure on the bones next to it. Also, if you've had ulcers before, you're at an increased risk to get them again. So I'm just going to palpate your foot, feel it for any bony abnormalities. Do you feel any tenderness? Great. All right, now I'm going to go on to the skin exam. What I'm looking for is dry, itchy skin on the bottom of the foot, or if you have any dry, scratchy skin, that could be tinea, which is like athlete's foot. I'm going to look for that too. In between your toes, any dampness, sweating, or moisture in there could become macerated, cause an infection. I'm looking for excoriation. Calluses happen frequently before an ulcer because they do cause increased pressure. If you happen to get a blister on your callus, be sure that you get that checked because you could have a wound underneath it. I'm looking for any type of oozing or gangrene. I'm looking at the toenails. Keep your toenails cut across. If around the edges here you get any calluses, you want to be sure and get those checked. You could have ingrown toenails, thickening of the nails. You could have fungus in there. I'm also going to feel for warmth or cool places that are maybe cold. That could be an infection. The warmth or cold could be a lack of circulation. Any erythema, redness, and leading into our circulatory examination, I'm looking for hair on your foot and your toes. That is a sign of circulation. I'm going to check your dorsalis pedis pulse and your posterior tibial pulse. An absence of these would mean a loss of some circulatory, decreased circulatory pressure in here, leading to maybe peripheral artery disease, and we'll talk about that a little bit more. I'm going to check your capillary refill. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. You've got good circulation in your feet. There is a disease called peripheral artery disease that if you lose any of these sensations, you could develop that or have developed that in your foot. I'm looking for swelling around the ankles. I'm looking for some varicose veins. That could always also cause some circulatory problems. Next, I'm going to go to the feeling in your feet. The monofilament we talked about prior. Just let me know where you're feeling at when I touch your foot. Big toe, middle toe, baby toe, below my big toe, the center, the outside, the heel, the top. All right, good job. Any loss of feeling in that area is called loss of protective sensation. And what's dangerous about that is if you had trauma or an infection or anything that's going wrong in your foot, you wouldn't be able to feel that. Next, I'm going to test your vibratory sensation. Just let me know, say okay when you stop feeling it. Okay. 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 Okay, with vibratory sensation, that progresses before the feeling sensation. You usually lose vibratory sensation first and then the feeling after that. Next, I'm going to do touch with something sharp and dull. You tell me whether it feels sharp or feels dull. Dull. Sharp. Good. I'm also going to test your reflex, your ankle reflex, and what this is indicative of is some neuropathy. It could be your sciatic nerves. I'm just going to relax your foot. I'm going to flex it back a little bit. Good job. Your foot just kind of flex up. I'm going to test your musculoskeletal strength. Pull your foot back towards my hand. There you go. Now push. You've got good strength. All right. Your examination went well. You have good circulation in your feet. Remember, the circulation has to do with your pulses and the feeling with the monofilaments and the vibratory. So you want to be sure, I'm going to just put this up a little bit. So be sure that you examine your feet every single day. If you're not able to see under your feet, then have someone check it for you, your kids, grandkids, friends, family, because you want to make sure that you check everywhere, all over, top and bottom, in between those toes every day. You want to keep your blood glucose within your target ranges that we talked about earlier that your doctor set for you. You also want to remember any calluses or pressure places on your feet. You need to let your doctor know about those, any pain. Keep your shoes well fitting. Keep a nice toe box in your shoes. Right now you only need your exam once a year, but if you start losing any of your sensory or feeling in your foot, we would go up. You're like a 0 risk right now, and it goes up to 3 depending on what is wrong with your foot. If you have deformities, ulcerations in the past, amputations. Luckily your feet are in good conditions and we want to keep them that way. So check those feet every day and check those shoes every day. Do you have any questions? No. All right, great. Thanks for participating.